Hi there, my name is Chelsea Ellingson and I'll be talking today about Bloom syndrome. So what is Bloom syndrome? It is the autosomal recessive disorder, and so this means that a person with the disease has to have both copies of their genes having mutations. So as a review, you can look at the one on the left, example, pedigree, that has a non-carrier mom and a carrier dad. So she is homozygous dominant and he is heterozygous, meaning he carries one good and one bad. Their kids are going to have two non-carriers that are homozygous dominant and two that are carriers, getting one bad from dad and one good chromosome from mom. So in the case of having a diseased child, usually the parents are both carriers, meaning they're both heterozygous for this allele. So their children are going to be the typical 1 to 2 to 1 ratio, and so you'll have one that is a non-carrier, which is homozygous dominant, two that are carriers that are heterozygous, and one that has the recessive alleles on both genes, and this is when they exhibit the disease. And the Bloom syndrome is caused by a mutation of the BLM gene on chromosome 15 at 15q26.1. So the BLM gene produces RECQ helicases, and remember, helicases are responsible for unwinding double-stranded DNA, and so you can see here double-stranded DNA, and this helicase is coming along, unzipping the double strands, creating this replication fork so that transcription can occur inside here. The BLM gene also codes for the BLM protein, which in healthy individuals prevents excess sister chromatid exchanges, which we'll talk about, and helps maintain stability during replication, which we'll get to later. There are 4 pathogenic variants, mutations that occur in BS. There's insertion and deletions, and so this causes frame shifts and makes the BLM protein not created. And so one of the examples is the BLM ASH allele has a 6-pair deletion and 7 base pair insertion in exon 10 of the BLM gene, and this insertion deletion mutation makes up about 1/3 of the variants. Another 1/3 of the variants is caused by nonsense mutations, in which a sense codon is converted to a nonsense codon or stop codon, which terminates translation, resulting in a truncated BLM protein. 1/6 of the variants is made up of missense mutations, in which there's an amino acid substitution, and this produces a non-functional BLM protein. And then there's intron variants making up the last 6 that cause splicing defects. These mutations cause an increase in chromatid gaps, breaks, and rearrangements, as well as quadradial configurations. So sister chromatid exchanges, or SCE, is what happens when there's chromatid rearrangement. It is the exchange of genetic material between 2 identical sister chromatids during mitosis. In healthy cells, SCE is not common, occurring in only a few chromosomes. So you'll see here there's one darker sister chromatid and one lighter sister chromatid that have exchanged some genetic material. However, most of the sister chromatids are not going to exchange that material in healthy cells. In BS, however, it is 10 times more likely. So you'll see most of these chromatids have exchanged genetic material, and this is called hyperrecombination. Fun fact is that Bloom syndrome is the only disorder in which this level of hyperrecombination happens in the sister chromatid exchange. Next is the quadradial configuration that happens due to these mutations. This configuration is caused by the tendency of exchange between chromatids of homologous chromosomes at homologous sites due to chromosome instability. And so that is why this stability of chromosomes is so important in healthy BLM proteins. And so this instability, when there's a mutated BLM protein, causes this configuration here. So the symptoms of Bloom syndrome are unusually small size, with the average height only being 4'7". They also have a disproportionately small head. They also have high-pitched voices, redness of the cheeks and nose, lack of appetite in children, decreased adipose tissue, that's fat tissue, so sometimes they look anorexic. Immune system deficiencies, males are infertile, and females enter menopause early. And you can see some of these symptoms in the picture of this woman here, where she's very skinny and very short, hence why she's close to the steering wheel, and that pale skin. The life expectancy is extremely shortened in BS individuals due to medical complications. The average age of death is only 27, with the oldest being documented about 50 years old. Medical complications that happen are due because they are extremely high risk for the following diseases. There's COPD, which is a pulmonary disease, diabetes, gastroesophageal reflux disease, immunodeficiency, infections, predominantly ear infections and pneumonia. But the most cause of death is because of cancer. So who's affected? 27% are from Ashkenazi Jewish descent that have Bloom syndrome. Bloom syndrome overall is a very rare disorder, but there is an increased frequency in those of the Ashkenazi Jewish descent. Ashkenazi means is Hebrew for German, and so they originate in Eastern Europe, and those of specifically Polish descent are found to be more affected. And here are some stats on the frequency of Bloom syndrome in Ashkenazi Jews, and it's 1 in 134 are carriers. So how do you know if you're a carrier? You can have cytogenic analysis or molecular analysis. That's going to show the hyperrecombination. And if you are of Ashkenazi Jewish descent, there's a common BLM-ASH allele that can be tested for. The Jewish Genetic Disease Consortium recommends any couple of Jewish ancestry to get tested for all Jewish genetic diseases. For the general population, the variant must be known before you can be tested. Management and treatment. As of right now, there is no treatment for Bloom syndrome, so most of the time you're just going to treat the symptoms. So for example, someone with Bloom syndrome might develop diabetes, and you're going to just receive that standard treatment of diabetes. The biggest thing right now is going to be just getting tested if you think you might be a carrier and being aware that you might be that carrier. This concludes my presentation on Bloom syndrome. Here are the sources I used to compile all of this information, and I'm interested in seeing what question you guys may have for me on Bloom syndrome.